Behavioral Consult Group 3, Elson Preschool.
Jory Kazmala lives in Fort Wayne, Indiana. She is currently in her 4th semester and will graduate this December with her master's in applied behavioral analysis with autism from Ball State University. She completed her undergraduate at Ball State University in exercise science. She became a registered behavioral technician almost a year ago and has been working at a pediatric autism center. She plans to sit for the exam to become a BCBA following her completion of school. Noelle Maldonado lives in Florida. She graduated from Florida Tech Institute of Technology. She just took her BCABA board exam and plans to sit for her BCBA exam as well. She is currently enrolled at Ball State University's master's program for ABA. She currently works as a security officer at Northrop Grumman and an RBT at Full Spectrum and has a small private business selling individual items. Jamie Scipione is 30 years old and lives in Marlton, New Jersey. She is in her 3rd semester in the ABA program at Ball State. She works 2 jobs, one as a teaching assistant at an ABA-based private school for individuals diagnosed with autism spectrum disorder, and the other as an in-home therapist for individuals with autism and other developmental disorders. She has 4.5 years experience in the field of ABA and is currently going through the process of becoming a registered behavioral technician. Sarah Rausch lives in Cleveland, Ohio. She is in her 3rd semester at Ball State in the ABA master's degree program and is working 2 jobs in the field. Her first job was in special education as behavioral support in an elementary special ed classroom, and her second is doing ABA for a local company. She enjoys working with children with severe behaviors and has been doing so for about 5 years. She has been doing ABA for almost 10 years and finally decided it was time to get my master's degree and become a BCBA. Melissa Scott lives in Indianapolis, Indiana. She has been a registered behavioral technician for 5 years and has worked in ABA for 10 years. Currently, she is getting her supervision hours as well. She has experience working at a center, home, and in-school settings for the same company. She is in her 3rd semester at Ball State and will be graduating in May 2020.
Ellison Preschool consists of 200 students, 50 regular education, 150 special education. Consists of 3 to 5-year-old children. 20 classrooms consisting of 8 to 12 students in each classroom. There are 50 students who have speech services, and 25 of the 50 are nonverbal. There are 5 nonverbal students who use PECs. There is 2 speech therapists, 1 physical therapist, 1 occupational therapist. In addition, the school has 1 principal, 1 BCBA, and 4 to 6 parent volunteers daily. The school is reporting fighting between peers and aggression during playtime due to a lack of communication and turn taking. The target behaviors are aggression and tantrum. Aggression is any instance where a student makes contact or attempts to make contact with another individual. Examples include, but are not limited to, hitting, kicking, biting, and or scratching. However, may or may not leave redness or a mark. Non-examples include, but are not limited to, itching, kicking a ball in a game, and or giving a high five. Any instance of aggression begins when an attempt is made and or contact is made and ends after 3 seconds. Tantrum is any instance where a student cries, screams, and or kicks. Examples include, but are not limited to, crying while imitating tears, screaming, and or yelling above a conversational tone where it can be heard from another room, ranging in a distance of 6 feet and or kicking arms and legs in a swinging motion. Non-examples include falling resulting in getting hurt, playing a game, yelling, and or screaming during a game, and playing outside. An instance of tantrum behavior begins when a student has engaged in the tantrum behavior for 10 seconds or more. A new occurrence of tantrum behavior is recorded if instances are separated by 30 seconds.
What is functional communication training, or FCT? FCT is a commonly used intervention that can target an individual's social and functional living skills, communication with others, and more commonly is used to decrease negative behaviors. FCT is an evidence-based practice that uses differential reinforcement, meaning a person will learn a new alternative response or behavior different than the previous behavior that was functionally maintained by the problem behavior. To find the most success with FCT, results have shown when implementing the intervention to use the person's highest reinforcing as a motivating operant or an actual alternative behavior. Results from less successful trials have been paired with punishment procedures as well as a lack of training with the staff, teachers, and other professionals responsible for implementing the intervention. Common FCT include Picture Exchange Communication System, or PECS, sign language, and devices used for communication. What is video modeling? Video modeling is a recording of a person teaching a skill or an appropriate behavior. Parents, teachers, and other professionals are trained properly through a training method like video modeling. Interventions will be properly conducted and individuals will have a decrease in problem behaviors. Some keys to success to consider is having the video include an incorrect and correct example of the skill, as well as an example of a trainer and how a client should react. Other successful tips is having an orientation with staff, allowing access to the video at all times so that staff can watch the video again right before a session and follow-up trainings throughout the sessions. Common skills and behaviors used for video modeling is functional communication training, imitation skills, manding, and discrete child training, as well as a video modeling of appropriate behaviors can be used to decrease problem behaviors and teach a client to respond correctly. Steps for implementation. Functional communication training and video modeling will be implemented together. During the implementation process, you want to first make sure to determine content for the video modeling. After the video is completed, you will then want to have an orientation for all staff members involved, review videos prior to the session beginning, and review with the current and new employees periodically throughout the sessions. Staff will implement functional communication training with errorless teaching with their client. Staff will also need to record data appropriately, but will learn that through video modeling as well.
Materials to be used throughout intervention include clickers and counters to collect frequency of aggressions, timers and stopwatches for recording the duration of tantrum behavior. The school provided materials for PECS as well as the primary method of communication for each student. The highest reinforcer was made available prior to each session to ensure immediate delivery was possible upon demonstration of the target behavior. Materials also included behavior data sheets to document behavior occurrences, such as frequency of aggressions and duration of tantrums, data sheets to tally all mands during manding sessions, a video camera to record the video modeling of FCT for staff training, and iPads or TVs to watch the video modeling training video.
This is an example of the MAN data sheet. It will be used for an FCT. So here you see that you will put the patient's name, the date and time, item requested, the frequency, meaning tally, for a spontaneous mand, frequency tally for prompted mand, and the total mands. Then, for example, you can use for my turn. This is an example of the duration data sheet for tantrum. You will record first the patient's name, the date, time, and location in the far left-hand corner. The next column, you will record the behavior observed, the start time, the end time, and above the end time, you will record the activity, for example, playing ball. Below the activity, you will record the total duration, meaning the total time from beginning to end. This is an example of our aggression data sheet. You'll record the patient's name, the date, staff initials, the total frequency of aggressions, tally by using a clicker.
The consultant and the student will practice turn taking with the appropriate prompting of "my turn" by either the consultant or additional professional seated behind the student. The professional seated behind the student will implement errorless learning when necessary. The student will be prompted to communicate in the way that best suits their skills, whether it be verbally, by using PECS, an iPad, or sign. After "my turn" has been mastered across 3 consecutive sessions at 80% independence, the skill will be transferred to the play setting of Ellison Preschool. Prompting will continue to ensure there is a smooth transition from the clinical setting to the naturalistic setting. As the man becomes more spontaneous, the level of prompting will decrease. The goal will be for the student to engage in appropriate behavior by requesting "my turn" independently to gain access to the preferred item as a replacement to aggressive and/or tantrum behavior.
Ellison School implementation of video modeling. Following the video presentation on functional communication training implementation, the staff will be trained by the consultants with the in-school BCBA present. The BCBA will be present in order to ensure fidelity of treatment later, as well as co-teach the process. Staff and parent volunteers will practice and review steps of implementation, as well as methods of prompting to ensure errorless learning. The second training session will have the in-school BCBA training the staff with the consultant supervising. This flips the roles in order to ensure fidelity of implementation when the consultants are not present. Ellison School implementation of FCT. After receiving the proper training either by the consultants or the in-school BCBA, the staff and volunteers will facilitate turn taking with the students by prompting the children to request "my turn" first with adults and then to peers when a toy or activity is desired. This can be done verbally or with an AAC such as PECS, Proloquo to go on the iPad, or even signs. The goal is to increase communication and decrease frustration and other maladaptive behaviors targeted for reduction, for example, aggression and tantrums. FCT will be taught errorlessly in order to reduce the frustration, and data on behaviors as well as spontaneous mans will be taken to evaluate the progress long-term.
Parent meetings will be conducted to discuss consent for students prior to the start of intervention. The goals to work on at home will be discussed with the parents as well as the materials needed to work on those goals. Training will be provided through video modeling to the parents on functional communication training. The video will be available through a secure website for parents to access if needed or if they cannot attend the previously scheduled meeting. Man sessions will be conducted by trained staff in the school setting. The consultants will be in touch with parents on their child's progress with communication, problem behaviors, and any additional needs and concerns. Consultants will provide additional training for the parents regarding functional communication training and manned prompting if requested.
We chose Ellison Preschool for our project, and there is 200 students consisting of 50 regular educations and 150 special educations. The behaviors we chose to target were aggression and tantrums. The students were fighting over toys, resulting in maladaptive behavior such as aggression and tantrum. Our intervention was FCT, and we used differential reinforcement and high reinforcers for appropriate behaviors. We used video modeling to train staff how to use FCT. Parent meetings were held. Man prompting training provided for staff, and other additional trainings, if needed, will be provided for staff, parents, and other volunteers for intervention implementation.